Hi there.
Hi.
My name is Brittany. I'm going to be your nurse today. Are you okay with me checking out your chest cavity, seeing how your heart and your lungs sound?
Yeah.
Okay. Tell me your name.
Haley Powers.
Are you allergic to any medications?
Mm-mm.
Are you allergic to any foods?
No.
Do you take any medication on a regular basis?
Just some steroid cream for my eczema.
Okay. Any other past medical history that I need to be aware of besides the eczema?
I get chronic urinary tract infections.
Okay.
And I have eczema.
Okay, perfect. Any past medical history in your parents, grandparents that I need to be aware of?
On my dad's side, they have really bad high blood pressure, and then on my mom's side, her dad had cancer.
Okay. Do you know what kind of cancer?
Prostate cancer.
Okay. Does anybody have high cholesterol? Do they take any medication for stuff like that?
Yeah, my dad does.
What about diabetes?
I'm not sure. I don't think so.
Okay, perfect. Tell me what you do for a living.
I'm a full-time student.
And what are you going to school for?
Dental assisting.
Okay. Are you exposed to any harsh chemicals? Are you chronically, inhaling lots of polluted air, anything like that? Okay. Good deal. Well, if you don't mind, we're going to get started, okay?
Okay.
All right. So first things first, I'm just going to check out your chest. I need you to sit up nice and straight for me. Perfect. Everything looks good. Doesn't look like you have any deformities. Are you having any issues today that you want to tell me about while we're talking about your lungs?
Like last Sunday afternoon, night-ish kind of time, I noticed that I had been coughing. I'm still coughing, and I keep coughing stuff up, and it's like a greenish yellow color.
Okay, and that started Sunday, maybe around dinner time?
Yeah.
Okay. Have you ran a fever with any of it?
Not that I know of.
Perfect. Okay, so we're going to check out your lungs, and maybe that'll kind of tell me why you've been coughing, kind of tell me what's going on. But like I said, everything looks good as far as inspection, so if you don't mind, I'm just going to kind of palpate or touch around on your chest and your back. Let me know if anything hurts or if you feel any discomfort, okay?
Mm-hmm.
You okay?
Yeah, sorry.
Does this hurt at all?
No, I really can't stop coughing.
Okay, I need you to shift for me. Just move your body. Perfect. We're going to press around on your back as well. You having any tenderness down here on the sides?
No, no.
Perfect. So next, what we're going to do is I want you to sit just like that for me.
Like this?
Uh-huh.
Okay.
I'm going to put my hands back here, and what I'm going to do is we are just checking to see, make sure everything's moving symmetrically, make sure both of your lungs seem to be filling up like they should be. It's called a respiratory excursion. So what that means is I'm going to press my thumbs kind of close to your spine back here, and I'll tell you to take a big deep breath in, and I'm watching for symmetry, making sure everything is moving like it should, and then you'll exhale, okay?
Okay.
Sit up nice and straight.
Second.
That's perfect. Big deep breath in and hold it. Good. And exhale. Okay, we're going to do one more time. Big deep breath in and hold it. And exhale. Perfect. Everything went well. So next I am going to percuss or kind of tap across my finger just like this. I'm going to work my way down your back and listen to what kind of sounds it gives me, okay?
Okay.
You just sit just like that, and you can take deep breaths, breathe just like normal. Perfect. So what I'm going to get you to do is kind of raise your arms up like you would be leaning across the desk at school. Lean forward just a little bit for me. Good deal. And I'm going to do the same thing on the side, okay?
Mm-hmm.
Just going back and forth, making sure everything sounds the same all the way across. That's exactly what we want. All right, relax for me. And face back this way. Perfect. Now we are going to do what's called tactile fremitus, and I'm going to place my hand across your chest, and I'm going to do a few times on the front, and then we're going to spin around and do your back again, but every time I place my hand, I need you to say 99, okay?
99, 99, 99, 99, 99, 99.
Perfect. Spin back around for me. And we're gonna do the same thing across here.
99, 99, 99, 99, 99, 99, 99.
Perfect. All right. Now, since I've got you this way, I'm just gonna listen. I'm gonna place my stethoscope, and we are gonna work my way across and down your back. You just take deep breaths, and if we're going too fast or you're going too slow, just let me know, okay?
Okay.
Perfect. You go ahead and spin around for me. We are going to listen to the front of your chest. Same deal. We'll place and we'll go across, and you just take deep breaths for me, okay?
Mhm.
Good. I'm going to get right up underneath here. Take deep breath. Good. And one more on this side. Take deep breath. Perfect. And we're going to listen to this side. I need you to raise those arms up kind of like you did a minute ago. Deep breath in. I'm going to come around to the other side.
Okay.
Deep breath in. One more. And last one on this side. Good. All right. And last but not least, I am going to listen, and you're going to say 99, that phrase for me one more time. I'm going to listen to the front, and we're going to listen to the back, okay?
Mm.
Again, I'm listening for everything to be the same all the way across.
99, 99, 99, 99, 99, 99.
All right, go ahead and spin around for me. We'll do one more time across the back.
99, 99, 99, 99, 99, 99,
Couple more.
99, 99.
Perfect. Right, so that ends the respiratory part of the assessment. And it sounds like you have a little bit of consolidation down on that lower left side. So we'll talk with the doctor and see, that may be what's causing this cough, see if we've got anything going on. We'll probably do a chest x-ray. But before I talk with him, I'm going to check out your heart and make sure everything is going okay with that. And then we'll go from there.
Okay.
Okay?
Mm-hmm.
So just going off of what I see right now, it doesn't look like that your heart is wanting to beat out of the chest. It doesn't look like it's pulsing or kind of lifting. If you don't mind, I'm just going to palpate a little bit. We're going to start down here. Going to get underneath that bra strap just a little bit so I can feel that nice apex of the heart. Good. We're going to go right here. And right there. Good. All right. Now we're going to palpate the carotid arteries. Let's check your arms. And we'll do this arm. Perfect. And if you don't mind, I'm going to get down. So I am going to check out the rest of your pulses. We're going to work down our leg, okay? So I need you to kind of kick those legs out for me. And we are going to check. Right, so we are going to check the dorsalis pedis pulse, and that's the one on top of your foot. Now it feels good. Let's do this leg. Perfect over there. And this one is the posterior tibialis pulse, and that is because it is kind of behind your tibial bone. Good on that side, and it's also right inside that ankle bone. While I'm down here, I'm going to check your capillary refill. That is where I press on your nail bed and just make sure that the blood flow kind of comes right back to it, and that's what we want. That means there's good perfusion, okay?
Mm-hmm.
Perfect. Let's do this side. And we're going to do the same thing with your fingers. Just get one on each hand. Good. Same for that one. Good. I've already messed with your radial pulses. Those are there, and I've been pressing on your carotid pulses all afternoon. Next, I'm just going to check for some edema. That is where your legs or your extremities are pitting or holding on to like extra fluid, stuff that they shouldn't be. It means something's going on with your heart. It's not pumping like it's supposed to be. So what I'm going to do is I'm just going to kind of gently press down your shin, and with that pitting edema, those marks will stay. So when I run my finger back across it, you'll feel kind of rooted going down, but I didn't feel anything. So let's do this side. And that all feels great. So we've already checked capillary refill, no edema, and your pulses feel good. Next, I am going to listen. We don't really do that percussion that I was doing to your lungs earlier just because there are some things that kind of get in the way that would interfere with us trying to figure out that heart border, like breast tissue, in men if they have a lot of musculature, or in people that tend to be a little overweight or obese. There are some issues with getting the accurate measurements on that cardiac tissue. So we're going to skip straight to the listening phase. We are going to work our way across, and I'll tell you, but I'm kind of going to go in a zigzag pattern and go down here. We're going to listen one way across, and then I'll come back up, okay?
Mm-hmm.
First, I'm going to listen on this side to the aortic location with my diaphragm. That's kind of right on the right side of the sternum. And then we'll go across. Listen on the pulmonic location. And that's on the left side of the sternum. And we're going to work our way down kind of that what's called Erb's point. Listen in the tricuspid. Perfect. I'm going to get right here, right underneath that breast tissue again. Sorry for my elbow. And listen right here at the apex or the mitral location. Alright, I'm going to do the same thing again, but I'm going to listen with the bell this time. We listen with different sides just because they differentiate certain sounds a little bit better. One hears more low-pitched sounds better, and the other side hears high-pitched sounds, okay?
Mm-hmm.
Same thing. Going to go down about 2 spaces between your ribs. Listen on the right border. across. And come down. And right up underneath that tissue again. Alright, and I'm going to flip this back over to my diaphragm, and I'm going to listen right down here, and I'm going to palpate this carotid artery and make sure that our pulses are matching, okay? You just relax for me and breathe normal. So that I need you to turn your chin towards me just a little bit, yeah. Just relaxes this muscle right here that can sometimes interfere with that carotid pulse. While I'm doing this, I'm watching that clock over your left shoulder just to get a heart rate for this next minute, okay? Perfect. So your heart rate was perfectly normal. Exactly. Alright, so your heart rate was normal. I did hear a little bit of extra sounds that could indicate that we might have a heart murmur. We will definitely talk with the doctor. I'll let him know about those findings as well and let him come in and listen and see if that's something that we need to talk about with cardiology or what he wants to do about that as well, okay? But before I wrap up this assessment, I need to check your carotids, I'll check your other pulses and do one more test.
Okay.
I'm going to listen to those carotid arteries. I know I've already pressed on them a good bit, but and let's go across to this side. Good. Same deal. I'm going to listen with the bell this time, okay? And again on this side. Good. So those sound normal. I didn't hear any bruise or didn't feel any thrills when I was touching, so we're good on that. I have to do one more test with your arm. This is just going to check your perfusion status. We are going to make sure that both those arteries in that arm are working. So what I'm going to do is I need you to hold it up like you're going to give me a high five. And then we're going to go around on this side. We're going to close off both those arteries, and what I need you to do is open and close your hand 5 times. Perfect. So now we're going to let go Are you feeling any tingling sensation? Anything in your hands coming back? Feel like the blood flow's coming back to your hand?
Yeah.
We'll try one more time, okay?
Mhm.
Close off that. This is to make sure that this radial artery is gonna pump enough blood into your arm, your hand. Excuse me for that.
I need to.
All right, yeah. Open that hand 5 times. Okay. Is your hand kind of tingly?
Yeah. Okay. Well,
Do you feel like there's blood flow coming back into this hand?
yeah.
Good. So that basically means that if we need to put a radial line in your arm, that other artery is going to put enough blood into your hand that we're not going to worry about, your hand not getting oxygen and not getting blood and then not working.
Okay.
So that's what we were testing.
Okay.
All right, so what we're going to do now is that's all I have to do for the assessment. We are going to talk with the doctor, and I'll talk about, like I said, kind of those findings that I found when I was listening to your lungs, kind of over here on that left lower side, and then we'll talk about that heart murmur that I heard also, and see what he has to say, and we'll go from there. Okay?
Thank you.
You're welcome.